Welcome to a new session on the course School Organization, Administration and Management. In this present session, we will have a discussion on hypokinetic diseases like obesity, diabetes and hypertension. A disease brought on, at least in part, by sufficient movement and exercise is a hypokinetic disease. Hypokinesis has been identified as an independent risk factor for the origin and progression of several widespread chronic diseases, including coronary heart disease, diabetes, obesity and lower back pain. First, we shall discuss on obesity. Obesity means having too much body fat. It is not the same as being overweight, which means weighing too much. A person may be overweight from extra muscle or water as well as from having too much fat. Both terms mean that a person's weight is higher than what is thought to be healthy for his or her height. Obesity is defined as having a body mass index or BMI of 30 or more. BMI is a calculation that takes a person's weight and height into account. However, BMI does have some limitations. According to the Centers for Disease Control and Prevention (CDC), factors such as age, sex, ethnicity, muscle mass can influence the relationship between BMI and body fat, muscle or bone mass, nor does it provide any indication of the distribution of fat among individuals. Despite these limitations, BMI continues to be widely used as an indicator of excess weight. BMI provides a most useful population level measure of overweight and obesity, as it is the same for both sexes and for all ages of adults. However, it should be considered a rough guide because it may not correspond to the same degree of fatness in different individuals. Causes of obesity. Obesity is generally caused by eating too much and moving too little. If you consume high amounts of energy, particularly fat and sugar, but do not burn off the energy through exercise and physical activity, much of the surplus energy will be stored by the body as fat. Another cause is genetics. A person is more likely to develop obesity if one or both parents are obese. Genetics also affect hormones involved in fat regulation. For example, one genetic cause of obesity is leptin deficiency. Leptin is a hormone produced in fat cells and also in the placenta. Leptin controls weight by signaling the brain to eat less when body fat stores are too high. If for some reason the brain to eat less, this control is lost and obesity occurs. The role of peptide replacement as a treatment for obesity occurs. The role of leptin replacement as a treatment of obesity is currently being explored. And the second one is overeating. Overeating leads to weight gain, especially if the diet is high in fat. Foods high in fat or sugar, for example, fast food, fried food and sweets, have high energy density, or food that have a lot of calories in a small amount of food. Epidemiologic studies have shown that diets high in fat contribute to weight gain. The next cause of obesity is a diet high in simple carbohydrates. The role of carbohydrate in weight gain is not clear. Carbohydrates increases blood glucose levels, which in turn stimulate insulin release by the pancreas, and insulin promotes the growth of fat tissue and can cause weight gain. Some scientists believe that simple carbohydrates like sugars, fructose, desserts, soft drinks, beer, wine, etc. contribute to weight gain because they are more rapidly absorbed into the bloodstream than complex carbohydrates like pasta, brown rice, grains, vegetables, raw fruits, etc., and thus cause a more pronounced insulin release after meals than complex carbohydrates. This higher insulin release, some scientists believe, contributes to weight gain. Another cause is frequency of eating. The relationship between frequency of eating and weight is somewhat controversial. There are many reports of overweight people eating less often than people with normal weight. Scientists have observed that people who eat small meals 4 or 5 times daily have lower cholesterol levels and lower or more stable blood sugar levels than people who eat less frequently, like 2 or 3 large meals daily. One possible explanation that small frequent meals produce stable insulin levels, whereas large meals cause large spikes of insulin levels after meals. Another cause of obesity is physical inactivity. Sedentary people burn fewer calories than people who are active. The National Health and Nutrition Examination Survey (NHANES) showed that physical inactivity was strongly correlated with weight gain in both sexes. Another cause is medications. Medication associated with weight gain include certain antidepressants, that is medications used in treating depression, anticonvulsants, that is medication used in controlling seizures, etc. Some diabetes medications, that is medications used in lowering blood sugar such as insulin, and certain hormones such as oral contraceptives and most corticosteroids such as prednisone. Weight gain may also be seen with some high blood pressure medications and antihistamines. The reason for the weight gain with the medications differs for each medication with your physician rather than discontinuing the medication, as this could have serious effects. The next reason is physiological factors. For some people, emotions influence eating habits. Many people eat excessively in response to emotions such as boredom, sadness, stress or anger. While most overweight people have no more psychological disturbance than normal weight people, about 30% of the people who seek treatment for serious weight problems have difficulties with binge eating. Diseases such as hypothyroidism, insulin resistance, polycystic ovary syndrome and Cushing's syndrome are also contributors to obesity. Another reason is social issues. A link between social issues and obesity has been established. Lack of money to purchase healthy foods or lack of safe places to walk or exercise can increase the risk of obesity. We shall now see some of the signs and tests of obesity. The healthcare provider will perform a physical examination and ask questions about your medical history, eating habits and exercise routine. The two most common ways to assess your weight and measure health risks related to your weight are body mass index or BMI and waist circumference. BMI is calculated using height and weight. You and your healthcare provider can use your BMI to estimate how much body fat you have. Waist measurement is another way to estimate how much body fat you have. Extra weight around your middle or stomach area increases your risk for type 2 diabetes, heart disease and stroke. People with apple-shaped bodies also have an increased risk for these diseases. Skin fold measurements may be taken to check your body fat percentage. Blood test may be done to look for thyroid or hormone problems. that could lead to weight gain. However, these tests are usually normal. Some of the commonly suggested treatment for obesity. First is changing your lifestyle. An active lifestyle and plenty of exercise along with healthy eating is the safest way to lose weight. Even modest weight loss can improve your health. You will need a lot of support from family and friends. When dieting, your main goal should be to earn new healthy ways of eating and make them a part of your daily routine. Many people find it hard to change their eating habits and behaviors. You may have practiced some habits for so long that you may not even know they are unhealthy, or you do them without thinking. You need to be motivated to make lifestyle changes. Make the behavior change part of your life over the long term. Know that it takes time to make and keep a change in your lifestyle. Work with your healthcare provider and dietitian to set realistic, safe, daily calorie counts that help you lose weight while staying healthy. Remember that if you drop pounds slowly and steadily, you are more likely to keep them off. The next one is medication and herbal remedies. You must see advertisements for supplements and herbal remedies that claim they will help you lose weight. Many of these claims are not true. Some of these supplements can have serious side effects. Talk to your healthcare provider before using them. You can discuss weight loss drugs with your doctor. Most people lose between 5 and 10 pounds by taking these drugs. Most people also regain the weight when they stop taking the medicine, unless they have made lasting lifestyle changes. Next is surgery. Bariatric surgery can reduce the risk of disease in people with severe obesity. These risks include arthritis, diabetes, heart disease, high blood pressure, sleep apnea, some cancers and stroke. Surgery may help people who have been very obese for 5 years or more and have not lost weight from their treatments such as diet, exercise or medicine. Surgery alone is not the answer for weight loss. If we can train you to eat your less, but you still have to do much of the work. You must be committed to diet and exercise after surgery. Talk to your doctor to learn if this is a good option for you. Here we shall have a discussion on diabetes. Diabetes, often referred to by doctors as diabetes mellitus, describes a group of metabolic disease in which the person has high blood glucose or blood sugar, either because insulin production is inadequate or because the body cells do not respond properly to insulin, or both. Patients with high blood sugar will typically experience polyuria or frequent urination. They will become increasingly thirsty and hungry. There are mainly 3 types of diabetes. The first is type 1 diabetes. The body does not produce insulin. Some people may refer to this as insulin dependent diabetes or juvenile diabetes or early onset diabetes. People usually develop type 1 diabetes before their 40th year, often in early adulthood or teenage years. The second type of diabetes is type 2 diabetes. Here, the body does not produce enough insulin for proper function, or the cells in the body do not react to insulin, or they become insulin resistant. The third type is gestational diabetes. This type affects females during pregnancy. Some women have very high levels of glucose in their blood and their bodies are unable to produce enough insulin to transport all the glucose into their cells, resulting in progressively rising levels of glucose. Diabetes mellitus is a chronic disease for which there is no known cure except in very specific situations. Management concentrates on keeping blood sugar levels as close to normal without causing low blood sugar. This can usually be accomplished with a healthy diet, exercise, weight loss, and use of appropriate medications like insulin in case of type 1 diabetes, oral medications as well as possibly insulin in type 2 diabetes. Attention is also paid to other health problems that may accelerate the negative effects of diabetes. These include smoking, elevated cholesterol levels, obesity, high blood pressure and lack of regular exercise. Specialized footwear is widely used to reduce the risk of ulceration or reulceration in at-risk diabetic feet. Common diabetes symptoms include frequent urination, intense thirst and hunger, weight gain, unusual weight loss, fatigue, cuts and bruises that do not heal, male sexual dysfunction, numbness and tingling in hands and feet. Some of the complications faced by diabetic patients are eye complications, glaucoma, cataracts, diabetic retinopathy and some others. Second is foot complications, neuropathy, ulcers and sometimes gangrene which may require that the foot be amputated. Skin complications. People with diabetes are most susceptible to skin infections and skin disorders. Next is heart problems such as ischemic heart disease when the blood supply to the heart muscle is diminished. Then hypertension, common in people with diabetes which can raise the risk of kidney disease, eye problems, heart attack and stroke. Mental health. Uncontrolled diabetes raises the risk of suffering from depression, anxiety and some other mental disorders. Hearing loss. Diabetes patients have higher risk of developing hearing problems. Gum diseases. There is a much higher prevalence of gum disease among diabetes patients. Gastroparesis. The muscles in the stomach stop working properly. Ketoacidosis. A combination of ketosis and acidosis, accumulation of ketone bodies and acidity in the blood. Neuropathy. Diabetic neuropathy is a type of nerve damage which can lead to several different problems. HHNS or hyperosmolar hyperglycemic non-ketotic syndrome. Blood glucose levels shoot up too high and there are no ketones present in the blood or urine. It is an emergency condition. Nephropathy. Uncontrolled blood pressure can lead to kidney disease. PAD or peripheral arterial disease. Symptoms may include pain in the leg, tingling and sometimes problems walking properly. Stroke. If blood pressure, cholesterol levels and blood glucose levels are not controlled, the risk of stroke increases significantly. Erectile dysfunction or male impotence. Infections. People with badly controlled diabetes are much more susceptible to infections. Healing of wounds. Cuts and lesions take much longer to heal. We shall now see some of the methods to control sugar level for a diabetic patient. Make diabetes meal plan with help from your healthcare team. Choose foods that are lower in calories, saturated fat, trans fat, sugar and salt. Eat foods with more fiber such as whole grain cereals, breads, crackers, rice or pasta. Choose foods such as fruits, vegetables, whole grains, bread and cereals and low fat or skimmed milk and cheese. Drink water instead of juice and regular soda. Do regular exercise and workout. Here we shall have a discussion on hypertension. Hypertension is another name for high blood pressure. Medical guidelines define hypertension as a blood pressure higher than 140/90 millimeters of mercury. It can severely impact quality of life and it increases the risk of heart disease, stroke and death. High blood pressure is a common condition in which the long term of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. Normal blood pressure is 120/80 mm of mercury. A number of risk factors can increase the chances of having hypertension. The first one being age. Hypertension is more common in people aged over 60 years. With age, blood pressure can increase steadily as the arteries become stiffer and narrower due to plaque buildup. The second is ethnicity. Some ethnic groups are more prone to hypertension. Third is size and weight. Being overweight or obese is a key risk factor. Fourth is sex. The lifetime risk is the same for males and females, but men are more prone to hypertension at a younger age, while rates tend to be higher in women at older ages. Fifth one is the existing health conditions. Cardiovascular diseases, chronic kidney disease and high cholesterol levels are predictors for hypertension, especially as people get older. Some of the other contributing factors include physical inactivity, a salt-rich diet associated with processed and fatty foods, low potassium in the diet, alcohol and tobacco use, certain diseases and medications, family history of high blood pressure and poorly managed stress that also contribute. There are two types of high blood pressure. The first one is primary or essential hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary or essential hypertension, tends to develop gradually over many years. Primary hypertension can result from multiple factors including blood plasma volume and activity of the hormones that regulate of blood volume and pressure. It is also influenced by environmental factors such as stress and lack of exercise. The second is secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause high blood pressure than does primary hypertension. Secondary hypertension has specific causes and is a complication of another problem. It can result from diabetes due to both kidney problems and nerve damage, kidney disease, pheochromocytoma, a rare cancer of adrenal gland, Cushing syndrome, which can be caused by corticosteroid drugs, congenital adrenal hyperplasia, disorder of the cortisol secreting adrenal glands, hyperthyroidism or overactive thyroid gland, hyperparathyroidism, which affects calcium and phosphorus levels, pregnancy, sleep disorder, obesity, chronic kidney disease, adrenal gland tumors. Certain medications such as birth control pills, cold remedies, decongestants, over the counter pain relievers and some prescription drugs. illegal drugs such as cocaine and amphetamines, alcohol abuse or chronic alcohol use. Diagnosis of hypertension. Diagnosis of hypertension is made by measuring blood pressure over the last 3 clinic visits using the upper arm cuff device called the sphygmomanometer. The doctor will take a history and perform a physical examination before diagnosing hypertension. Some additional tests can help identify the cause of high blood pressure and determine any complications. And these tests include urine tests, kidney ultrasound imaging, blood tests, electrocardiogram or ECG, and an echocardiograph. We shall now discuss some of the measures to prevent hypertension. Adults over 18 should have their blood pressure checked regularly. Lifestyle changes may help control your blood pressure. Follow your healthcare provider's recommendations to modify, treat, control possible causes of high blood pressure. Some of the methods to reduce hypertension. First one is changing your diet. Try more healthy non-meat proteins. There are many things that are not meat that contain protein. Legumes, seeds, nuts have great nutrients in them and should be added to your diet. They have plenty of omega-3 fatty acids, fiber and phytochemicals as well as proteins. This is because these foods have high calorie content and should always be consumed in moderation. Try including walnuts, peas, beans, almonds, sunflower seeds, flax seeds, lentils and black beans into recipes and meals to get the vital nutrients they have on them. Second is reduce sodium intake. The first choice for reducing blood pressure is always lifestyle changes. One major cause of hypertension is too much sodium in your diet. Doctors typically recommend that those with hypertension limit their sodium intake to less than 1500 to 2000 milligram per day. Many processed foods including most canned soups contain high levels of sodium. Even processed foods that do not taste salty may have significantly more salt than is healthy. Do not add table salt to food. Ask your doctor if a salt substitute can be used. These often contain potassium chloride. Eat more whole grains. Choose whole grain instead of refined grains such as white bread, rice and pasta. Consume lean protein. Increase vegetable and fruit intake. Vegetables and fruit are integral to any heart healthy diet. The natural vitamins and minerals help combat weight gain, boost your immunity and keep blood pressure low. Tomatoes, broccoli, spinach, artichokes and carrots are good examples of vegetables that are high in fiber, potassium and magnesium. Use fruits such as pineapples, mangoes, bananas, blueberries, pomegranates and strawberries both as a natural treat and as a substitute for refined sugary sweets that you crave. Limit sugary treats. Refined sugars found in sugary sweets work against the healthy portions of the diet. They can gain weight and mess with blood pressure. Avoid alcoholic and caffeinated beverages. Beverages with caffeine and alcohol should not be consumed when you suffer from hypertension. Caffeine causes an increase in heart rate and blood pressure, especially in high doses. Try to have less than 400 milligram per day of caffeine. The second option is changing lifestyle. Exercise more. Exercise of all kinds can help to control hypertension. Start working out for at least 30 minutes a day with aerobic exercise such as walking, jogging or swimming. Reduce your stress. Stress, anxiety and depression can increase hypertension. Learn to manage and cope with stress to improve your emotional and physical health. Quit smoking. Smoking is one of the most common and avoidable contributing factors to cardiovascular death. The added chemicals in cigarettes causes increase in heart rate and vessel constriction, which transiently increase blood pressure. The third is using medication. Maintaining a healthy weight and getting enough physical activity. Let us now summarize what we just discussed. Since the turn of the century, mankind has been designing machines to move for him or her. Thus, we have reduced our need to walk and run to a minimum. The human body is like a machine. Without movement, it cannot function properly. In earlier days, the leading causes of death were infectious diseases like tuberculosis and typhoid. Today, the leading causes of death are hypokinetic diseases. Hypo meaning low and kinetic meaning movement. Hypokinetic diseases such as obesity, high blood pressure, heart disease, strokes, diabetes, osteoporosis, cancer, anxiety, depression, arthritis and low back pain are growing at an alarming rate. Modern sedentary lifestyle increases the chance for hypokinetic diseases. Exercise has a major role in the prevention and management of hypokinetic diseases. Thank you for watching the session on hypokinetic diseases. See you again later with a new topic. Till then, goodbye.